local anesthesia binding site of sodium channel. Is it crystal clear? This is Shihuan. Today we are going to mnemonize local anesthesia, amino amides, and amino esters.
알겠다. 이거네. 몰라.
This mnemonic will really help you to remember amino amides and also amino esters. Local anesthesia that we use in the clinic has two groups. One is amino amide and the other is amino ester. And I depicted them in this drawing. If you just remember this drawing, you will never forget. Here, this is the chemical compound of amino amides and esters. It looks like these are legs, torso, arms, and head. This is the amide, and it looks like he. So he has lower protrusion as males have, right? But while Esther, since it looks like a female, she has upper protrusion. So you can remember in this way. This is a male, a prince, and this is the Princess Esther in the Bible. So this amide prince is presenting flower to the most beautiful princess, Esther, and he's saying that, Esther, am I deserve to love you? Wow, what a sweet, what a thrilling conversation he is giving to her, right? And am I? He's so nervous, so he's repeating I twice, and this is the key point, key mnemonic in a while we are going to talk about. Okay, so am I deserve to love you? Amide. Its name, I mean, his word contains its identity. It is amide, right? Alright, so don't never forget. Probably it'll be easier to remember than the forgetting, right? Alright, this Esther is a beautiful princess, and she has a ponytail hair, right? And she has a oily hair. What hair? Yes, oily hair. She has oily hair. So this is lipophilic. We can say that she has a lipophilic hair, right? And let's also draw lipophilic hair for this amide because his head is also lipophilic. So their heads are lipophilic. Okay, their heads are what? Lipophilic. And see that this her hair, Esther's hair, is very aromatic. Oh, smells good. So we call this head aromatic ring. Alright? And the reason why this aromatic ring is lipophilic, we will talk more about it in the mechanism section. Okay? To talk about its function briefly, it is lipophilic because it needs to penetrate into phospholipid bilayer, which permits lipophilic molecules. And this torso tells you whether it is amide or ester, right? Amide, since he is a male, he has a lower protrusion on his torso, while this ester is a female, so she has a upper protrusion. Alright, and remember that she is the princess of water. So she is standing on the water, representing that her legs are hydrophilic. Alright, so it is composed of tertiary amine and proton acceptor. As I mentioned earlier, amide says, am I deserve to love you? He has two eyes, right? So amides tend to have two eyes in its name. Let's take a look at amide's name. Articane, it has two eyes, right? Articane, right? And bupiva, okay, what is this? This one is the sugarcane, but sugarcane. Let's just add here I. Okay, I was just tired of writing all canes, so I just drew here one big cane, sugarcane, right? Okay, so bupiva, cane, it also has two eyes. Dew cane, it has two eyes, right? One 2, right? And ethylocane, lidocaine, ribobupivacaine, prilocaine, ropivacaine. So it all has 2 I's. Wow. Right? So if you find 2 I's, you can say that it is amide. It belongs to amide group. As you can see here, this Prince amide has 2 I's. All right? Okay, let's take a look at Ester. Ester tends to have only how many I's? 1 I. Okay, only 1 I. And let's take a look at examples. Benzo cane, right? Benzocaine, it only has 1 I. And the chloroprocane, we cannot find the I's here. Cocaine, procaine, proparacaine, tetracaine, they only have 1 I in their names, right? Very good. Now let's take a look at metabolism. It is very easy to remember, right? Amide, since the amide sounds like it is amino acid, amino acids are usually synthesized and metabolized in the liver. So it is biotransformed in the liver, right? While however, ester is hydrolyzed in the blood by plasma esterase, right? As you know that there is always there is an enemy for beautiful princess, right? Like a rich, ugly rich who is always jealous, right? So the plasma esterase, the rich, the ugly one is very bloody, so it is plasma, right? And Esther, she wants to erase Esther, esterase. Okay, so one who erases the ester is the esterase, right? Ester erase esterase. Since the enemy is bloody, so plasma esterase. Crystal clear? All right, and we will before we go into the depths in it, let me give you some more mnemonics for the specific. Before let me move on to well explained mechanism behind it, let me give you some special features of articaine and benzocaine. You know, this articaine, this amide prince, is very artistic, and he is drawing who? He is drawing Esther. So this articaine, though it is amide, it belongs to amide group, it has Esther in its body. So articaine, it has amide, but also it has the ester group in its arm, so that it can be damaged by plasma esterase and it loses its function. For benzocaine, you remember, if you are a Korean, probably you have watched my video, Benz on Digest cookie, right? This is the Benz on Digest cookie, right? So Benz is nicely pasted on Digest cookie, okay? Benz, this brand mark is well pasted on the Digest cookie, okay? So it tells you that it is the topical anesthesia. It is good for topical anesthesia, and it is good to remember that ester groups are not commonly used for local anesthesia injection because it causes some of patients allergy. Okay, this ester group is very allergic to some patients. For you to remember this, you just to recall this drawing. This Ester princess, though she likes Amide princess, she has to say bye-bye to him because his papa is calling her. So she's saying that papa is calling me, so I need to say bye-bye. Papa, 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 papa. All right? So she's saying that papa. Okay, because this papa tells you that it is allergic because of its metabolite, which is para-aminobenzoic acid. Okay, ester is broken down into para-aminobenzoic acid, which is PABA in abbreviation. Okay, so this molecule is the causative molecule of allergic reaction. Okay, crystal clear? And let me show you the mechanism of this local anesthesia, this handsome Amide and the beautiful Ester princess mechanism. Okay, if you inject, local anesthesia is released like this, and it has ionized form and unionized form. This Rn represents unionized form. Since it is unionized, and since its head is lipophilic, as I mentioned at the very beginning of the lecture, it can cross the phospholipid bilayer. And once it crosses, it is ionized. And ionized form is called active form. Okay, once it is activated, it attaches to the local anesthesia binding site of sodium channel. Is it crystal clear? Once it binds to the local anesthesia binding site, it blocks the sodium influx. Let's say that this is the nerve fiber, and stimulation or stress is applied at the nerve ending. So it is stimulated. So this site is stimulated, and it is depolarized, and the signal travels along the way because it has the sodium channels inside and sodium's influx in. So depolarization continues along the nerve fiber. So as you can see here, sodium is going inside, and as you can see this graph, this little graph, you can see that the membrane being depolarized. Once this local anesthesia molecule is ionized, it becomes activated and it attaches to the local anesthesia binding site. Thus, it blocks these sodium molecules to go inside. By doing so, we can successfully block the depolarization. Is it crystal clear? For this reason, this signal cannot travel all along the nerve fiber. By working in this way, local anesthesia can successfully block the depolarization, and this signaling will not reach central nervous system for us to perceive pain or other sensation. One thing which is very important is that this unionized form can be ionized depending on the pH of the tissue or the environment. It is very important because in low pH, this unionized local anesthesia molecule tends to be ionized. If it is ionized, it cannot cross the cell membrane because this cell membrane does not permit molecules which have a charge. Is it crystal clear? So the pH of the local anesthesia is very, very important. And that is the reason why in pus, local anesthesia does not work well. Because, let's say, this yellow is pus or abscess. Pus pH is very low. Let's say it is pH of 5. And the pH of local anesthesia is 8. So in high pH, which is alkali, local anesthesia solution has more unionized form than ionized form. More unionized forms than ionized forms. Once it is injected, let's say tissue has 7.4 pH of 7.4. So only little becomes R and H at the tissue. But since it has a pus, when this unionized forms infuses into pus or mixed with pus, these unionized forms are becoming ionized forms. So they became ionized. They cannot go into nerve fibers to take connection. right? Isn't it sad? For this reason, if a patient has a big pulse and you try to anesthetize the site, you cannot achieve local anesthesia effect because this unionized local anesthesia, which can go into the nerve fiber, are ionized. That is the reason why they cannot cross the phospholipid layer. Thus, it cannot block their binding site, which is inside a cell. So local anesthesia binding site is inside a cell, but because they cannot cross, because they cannot cross the lipid layer, it cannot take effect. They need to be ionized once it crosses the cell membrane. If they are ionized inside a cell, they are now called active form. So being activated prematurely is not good. Okay, always there is a time for something.